Pain during movement versus end range pain is an important distinction when it comes to active and passive movement testing in an orthopedic evaluation. And while both can be part and parcel of the presentation of a variety of disorders, the real distinction that I'm making in my head is if there's pain during movement, it's likely a mechanical joint problem, possibly structural, possibly contractile, but it's not going to be tight tissue. End range pain is where it could possibly be due to tight tissue. If the motion is limited and at the end of its limited range of motion, it's painful, most notably a stretching kind of pain, then we can start to think it might be due to tight tissue. But joint mechanical issues can present with pain during movement and or end range pain. Contractile tissues, yes, can produce pain during movement when that specific part of the tendon is dysfunctional. However, we typically need to apply a load to create that pain. For example, going into shoulder flexion and feeling just some pain at 100 degrees that passes as you go into a full end range without any limitation in mobility is typically not going to be contractile. Whereas if I'm pushing hard on the shoulder in that range of motion and it's producing pain, it's more likely that it is contractile. But pain during movement versus end range pain is a clear way for me to start to think, is this more a joint problem where the joint just can't move well at 100 degrees or can't move well at a very specific part in the range of motion, actively and possibly passively? Or is it tight tissue if the pain is only presenting at end range pain where that end range is limited?